Ladies and gentlemen, welcome to the Community Resources Meeting Patients' Needs webinar. Your host, Ms. Dinah Bungs, will now begin.
Good afternoon, everyone, and welcome. My name is Dinah Bungs, and I am from Healthcare Quality Strategies. Janet Noth, the liaison for the Atlantic Cape Community Coalition, is unfortunately unable to join us today. However, we are thrilled to have the honor of hosting this webinar. As you may already be aware, we are the CMS Partnering Quality Improvement Organization for New Jersey. Our project's mission is to work with designated communities to facilitate implementation and spread of best practices throughout the state to help New Jersey meet the national goal of reducing unnecessary 30-day rehospitalization rates of Medicare seniors by 20%. Today's webinar is about connecting the resources in the community to the patient being discharged, whether it is from the hospital or a nursing home. The Atlantic Cape Coalition identified community resources as one of the areas of focus when they met in December of last year. This webinar will provide all staff members that are involved with discharging patients a more comprehensive look at the services available to the patient that is going home and the connection to that service. Also, the ADRC website will be presented live to guide you through the many options you now have for finding and disseminating information. Your phone lines are muted, and after the presentation, the operator will open the lines for questions. And finally, at the end of the QA session, the operator will ask polling questions to obtain your feedback about the presentation, so please stay with us until the polling concludes. Also, please note that we will not be monitoring the chat room. As noted, please hold your questions to the end. With no further ado, I would like to introduce our first speaker, Barbara Peacock, the clinical educator from Crest Haven Nursing and Rehabilitation Center in Cape May, who served as the leader for the Community Resources subgroup in the coalition.
Thank you so much. I'm glad to speak with everyone today. We provided a multi-provider group consisting of hospitals, nursing homes, and the area aging and agency members. We met to discuss and review the current available information to both providers and patients and families. Our goal was to develop a concise, functional description of all available services in the Cape May County and Atlantic County region. When we talked about it, we wanted both professionals and individuals to be able to have greater access to and utilize a variety of services, including but not limited to physicians, social work, PT, OT, and speech, Medicare, Medicaid, psychiatry, senior centers, nursing, pharmacy, nutrition, government, and disability. That is a lot of information. We did look for available sites, as you'll see on the next slide, and we came up with several. The Atlantic Cape Community Coalition webpage at HQSI.org, NJ211, and NJ Health are all available on computer, and it's available to providers to post information as well as persons who want to utilize the information to find it. While we were performing on this committee, New Jersey mandated the ADRC for all counties. It's the Adult and Disability Resource Connection. It's mandated for all 21 counties in New Jersey, and it has to include all the county available information. And that for us was like a godsend, because we realized that there was no way that our group individually and without funding could come up with anything that was totally comprehensive to our community, but the ADRC is. The impact of our committee, the patients were impacted, all the residents of Atlantic and Cape May counties, and we're spreading this connection through the webinar today. The next step was to activate our target audience, social workers, discharge planners, and case managers throughout the provider setting. we did learn that keeping an updated resource list is beyond the scope of this subgroup. But with the ADRC and the avenues that are already out there online, we're really a success for it. And we're recommending the use of HQSI.org and the sites currently available, and that information will spread as persons use them. The next thing we're going to talk about is the community resources and meeting patients' needs. So I'm very happy to introduce Carol Lennox, CSW, Michelle Sessex, CSW, and Dennis McGowan. I'll turn it over to you.
Good afternoon. I'm Carol Lennox. I'm the Assistant Director and my new title, the Long-Term Care Coordinator for the Casey County Department of Aging and Disability Services. But as Barbara had mentioned, all 21 counties now are ADRCs, which is Adult Disabled Resource Connection. If you go to the next slide, there is a triangle kind of explaining how we thought this would impact everyone. Our department would be sort of a focal triangle for all social services, home care services, and the discharge patient along with the discharge planner. If you go to the next slide, you can also access our county website. That's our freeholder, Freeholder Christine Lamore, and our executive director, Ronna Broom. That also has a list of services and how to contact our office. I think Hear Me is a good way to put a call out to everyone, discharge planners, case managers, and social workers. Because in order to not have repeat customers at the hospital, we all are going to have to work together and pitch in and pull all our services and skills together. This will have an impact on Medicaid patients discharged to home and high risk for readmission. We're hopeful that if a discharge planner notices that a person is on Medicaid already, that they'll be able to contact social services or myself to check and see if that patient is already receiving services. So then we'll be able to implement those increased services actually. Our Board of Social Services actually would work very closely together, and how that comes about is sometimes discharge planners will be able to call the Casey County Board of Social Services, or sometimes they'll be able to call us. Either way, we can get the person to the services they need. So if you look to your left, we're the ADRC. We provide information and assistance. Our staff will then refer it to me. Now, if the person appears eligible for the JAC program or for the GO program, then I will process that. But if it's a situation where I find that they're really not nursing home level care, but that they're still going to be needing services, I will then refer it back to social services, and they'll try to accommodate the client with grants that they have. Now, if you look to the right, for social services, it would be their intake worker who is screened for all the services, and if they appear eligible, then they would, of course, send a social worker out to the home to address that and hook them up with the right services. But as you see the alternative care line between us, the social worker might then find that this client is JAC eligible, and it would come back to me. One of the things that we've learned with ADRC is the state has developed a wonderful screening tool. And I kind of work with this with every client or caregiver or discharge planner that would call in to go over different categories of the patient's needs, the ADL, the IADL, their communication, their health, their finances, to see which best program fits them. Next slide, please. Another great service that I think we'll be able to incorporate with discharge planners is our carefree transportation. It is a free service that we offer here in Cape May County. The only thing is the person would have to register, and there's no fee for that. And then they would call into carefree at least 2 days in advance. It's not necessarily for a client who wakes up in the morning and feeling sick and wants to see their doctor. This is more for folks who, have scheduled appointments with their doctor. This will also work if part of the discharge plan that the patient needs to return to the hospital for some reason or to their doctor, that they can use the discharge planner to help them with their free. They can also work in getting them registered if they find out that from the recent hospitalization they wouldn't be able to drive, so then they can get them registered. So that's also a very good thing. Next slide. Carefree transportation also works with us with our senior centers. And I think that the senior centers are a good social access for folks in the community who are 60 years of age or older, because from the socialization piece, they are able to participate in activities, have nutritious meals through our congregate services, and of course our Crescent Haven nursing home offers those meals, not only to the senior citizens at the congregate services, but to also our homebound mobile meals clients. It's a wonderful service. And as I say, it's very easy. It's a simple registration. You have an ID card, and it's really a link for families and individuals in the community. Next slide, please. When you register with Carefree, they will be sending out you this rider's guide. Mostly Carefree will transport to doctors, and I said to the senior centers, but they also offer a shopping bus in certain communities. It is a door-to-door service, and as I say, it's really helpful for everyone in the community. Next slide, please. I was explaining a little bit earlier about the senior center. As I say, they provide lunch, they provide socialization, which helps with their mental health, and I feel will greatly prevent readmission. Our center managers always watch the clients and look for changes. And if there is a change, if the client is, alert and oriented and able to understand that something's going on with them, then, they will discuss that privately with them. But they also will ask permission to call a loved one or family member. Or if it is someone in early stage dementia, then they will call the family member and indicate that. Next slide, please. Other services that our department provides is we have administrative services as a Department of Aging and Disability Services. We offer information and assistance entirely at what it says. We get anybody into the office if they're getting a bill from their Medicare or they're getting not a bill and they don't understand, our staff will help with that. Our staff are trained for SHIP, which is the state health insurance program plan. It is to help folks with secondary insurances, Medicare D, all of that. In fact, we will be October 23rd having an open enrollment. We will be having an open enrollment seminar at our Lower Cape Senior Center at 2612 Bayshore Road in Dulles, New Jersey. As I mentioned before, we offer congregate services, mobile meals, senior centers, and we do have contracted services. We contract for adult protective services with the Board of Social Services. Adult protective services is for folks in the community who appear to be not as oriented. There's either neglect, abuse, or exploitation going on. And of course that neglect self-neglect, we then refer an individual to the board, and their social workers who are trained would go out. They also provide care management for all our clientele, in addition to the JAC and the GO program. We offer a short grant for, say, you have a client being discharged who, yes, they can perform their ADLs and maybe even their IADLs, but they mentioned that they really, because of their CHF, are unable to run their vacuum cleaner, clean their bathroom. We do offer a short service, and you can access that with a referral to the Board of Social Services. We offer a dental service, which, once again, is through our county health department. We offer legal services through the South Jersey Legal Services. We have a respite caregiver support grant with the Board of Social Services, and also with body counselor at Cape Regional to kind of help caregivers become accustomed to what they're going to be dealing with their loved ones. We also offer a residential maintenance grant, and that we also call that safe housing. If any senior in Cape County finds themselves possibly homeless because of a situation in their home, such as, a broken toilet, a leaky roof, a problem with their hot water heater, they can call this program through the Board of Social Services, and a social worker from out to see if they're eligible. And it's a popular program, so it may have a waiting list. Next slide, please. I have the pleasure now to introduce Michelle Cusack, my counterpart in Atlantic County.
Thank you, Carol. First, I want to start off by mentioning that the Atlantic County ADRC is very much interested in working with the local hospitals, nursing homes, and service providers, as is the Cape County ADRC. On the next slide, you'll see our county website. And right now, I believe that's the way people are usually accessing information about the county. Now, if you notice on the next slide, we do get calls to our local ADRC number. Often if the client is on a Medicaid waiver and they're being discharged home, or they're at high risk for readmission to the hospital. What we like to do is to build a network with the Atlantic County ADRC and the local hospitals and the local nursing homes to get used to calling our ADRC line. And what would trigger a call to ADRC? Number one, a high risk for readmission into the hospital. One of the key things that many of our case managers are looking to do is to keep the client home as long as possible. And if someone's at high risk to re-enter the hospital, we want to be involved and try to prevent that. Another reason to call ADRC is if the client does have Medicaid and they're going home. The patient perhaps might state they already have a case manager, which means the county is already involved in some way. Or the patient states that they have home care. Sometimes they have home care, but they don't realize that they have a case manager that's involved with their case. The caller can either connect with services by calling the ADRC hotline, or they can upgrade the services that they already have. What happens when you call the hotline? The hotline number is 1-888-426-9243. An intake worker picks up the call. Our intake worker will then take down information from the caller, such as what their needs are, where the person's located, whether they're home or in the hospital, what the caller feels the main concern is, if they need home health, if they need Meals on Wheels, if they have perhaps home care and their needs are going to be greater when they return home. And then the call is referred to either our Medicaid waiver or community program case manager, that is if they're already on a program, or to our outreach worker. If it's referred to our, if they already are involved in a waiver program or any of our community programs, a case manager that has the client will go out and see the client and either increase services or talk to the client about alternate programs that they can get involved in. If they have no waiver program, and that means they don't have a case manager with the county at this time, an outreach worker will call them within 3 days of receiving the contact, and then 5 days a visit will be completed. At that point, the outreach worker will determine the needs and eligibility of the client for a social government program or for one of our county programs. Some of the programs and services that are available in Atlantic County are the JAC program, which is the Jersey Assistance for Community Caregiving. And that does delay nursing home placement and assists the client with home care, supplies, a little bit of respite for the family, medical day. And to be qualified for that, the client must meet nursing home level of care. And there is also an income requirement the outreach worker will go over with the applicant. We also have the global options for long-term care waiver, and that's the state Medicaid waiver program to keep clients at home and at a nursing home. On the next slide, you'll see we also offer a statewide respite care program, and that's to relieve an unpaid caregiver of the daily stress of daily caregiving. We also have a homemaker program that assists with tasks such as house cleaning, meal prep, shopping, and transportation. Some of the other programs that our ADRC outreach workers can connect clients to when they're discharged from the hospital are the Meals on Wheels program, our nutrition site, our transportation services, our Mr. Fix-It program, our homemaker program, which is in the Housing Authority building, and that's funded for our Older Americans Act, our Adult Protective Services, and also the other program that is also available is if a client is in a nursing home and they're going to be going home and they're going to need case management services or they have been on a Medicaid waiver program. If the local Office of Community Choice becomes involved and they come out and they do an assessment, they will be assigned a case manager before they go home for that readmission. And the case manager can do discharge planning, a meeting will be held, an interdisciplinary team meeting is held with the social worker at the nursing home and nurse from the Office of Community Choice, the client, and also the client's family. And at that point, all services are explained and what could be done in the community for the client are put in writing for the client and the person in the nursing home that's discharging the client. I now want to go over a client story that I have. We had a client that came in through our helpline through our personal assistance service program, our PASP program. She was a young nurse that had diagnosis with MS. She was 45 years old. She had just been laid off. Our outreach worker went out to see her. She was going to lose her services for our PASP program because she was no longer working. So the outreach worker went to see her, and she wanted no part of assistance. She was going to find another job as a nurse. She was an RN. About 6 months later, the call came back in again from our PASP program that she was going to be taken off the program because she was not working, volunteering, or going to school. So we sent another outreach worker out to visit with her. The outreach worker talked to her, worked on a Medicaid application with her, and set her up with global options. She's now receiving home care, and she has a case manager, and she also does volunteer work. She was unable to find another job. We were able to encourage her to get more services in the home. The case manager also assisted her with an application for Brighter Tomorrow, which is a grant for MS clients to get something of need in the home that isn't covered by another resource like Medicaid or Medicare. The case manager worked with the client, got the grant, and they were able to purchase her brand-new mattress. The client's now really thriving at home, though she would like to get back to work, but we do believe, indeed, we were able to keep her home and keep her active and still provide her with the services that she needed and also wanted. So she is in control of her services along with the case manager. She explains her needs, and the case manager completes the care plan. So that's one success story, and it does hit home because she was young and she's working up until she needs to go on Medicaid. I now want to turn it over to Dennis McGowan, the Public Awareness Coordinator for the Division of Aging Services.
Good, everybody. Thank you very much for inviting me here today to talk to you about our website. First, to just go over some acronyms. You've heard a couple things already. The first one is, we don't know whether we're DOAS or DUAS. That's our new division name. Our division has been the Division of Aging and Community Services, and we have been in the Department of Health and Senior Services. And on July 1, there were some changes at the state level. Health went back to their old name, Department of Health, and all senior services moved over to the Department of Human Services. So our name is now the Division of Aging Services. So in these slides, you'll see that DOAS, and you'll know what I'm talking about. ADRC, we already mentioned, is the Aging and Disability Resource Connection. This is a nationwide initiative to streamline services for both the aged and individuals with disabilities to help them who are in need of long-term services and supports. Aegis actually just equals Aegis. It used to stand for something it no longer does. That's the company that we contracted with to build this website we're going to talk about today. SAMS is a social assistance management system, and that is a client tracking system, and it also does have in there any agencies that have contracted with the county offices on aging, or that next initial, AAA, the Area Agencies on Aging. So if they have a contract with them, those agencies are in the SAM system right now. So what I'm going to talk today is about the ADRC website, and that's the address up there, www.adrcnj.org. This is a new website that we launched in May of this year, and it is a work in progress. So when you go there, know that there'll be a lot more things coming and being added to it. Before we launched the site, we had 3 different websites. We had one for caregivers specifically. We had one we built for ADRC when we first got the grants for ADRC, maybe now 8 years ago. And we also had our division website. But none of those sites, well, each had different resources, but none of those sites had all the consumer-friendly features and tools that this new website is offering us. So we actually pulled the plug on the old ADRC site and on Caregiver NJ, and all that information is now on the new site here. The site offers, again, a number of unique features that are good not only for consumers and service providers as well, and it also helps us in administering the site. There are various sections that I'm going to show you in a few minutes. One is called the Learn About section, and this gives New Jersey workers and consumers access to a database of national resources that was actually created and maintained by the folks at Aegis. So the company we contracted with is mostly responsible for this part of the website. They've built similar websites for 18 or more other state agencies on aging. We have the State Union on Aging for New Jersey, and they've done that for 18 other states. So they've gathered a lot of federal information that's on there, and we have and can add to that, but that is mostly maintained by them. And when it's printed out in single line, just what the URLs are, there was over 200 pages of links to all those different services you see there: assistive technology, caregiver supports, financial benefits, transportation, and other things. So it's a lot of information. We also have a services and providers database that we maintain. And what it is it involves all those contracted agencies that are on the SAMS system right now and others that we're adding to it. So on a schedule set by us, Aegis refreshes the information that's on our website with all the updated information that's kept in that SAMS system. So right now, there may only be 400 contracted agencies that are on SAMS. We're adding about 4,000 more within the next couple of weeks. So it'll be a very robust system of New Jersey-specific service and providers that you can get information on. Once they're in that system, then we'll take over the responsibility of contacting them to make sure their website is up to date. We'll do that probably annually, maybe even more often. And that'll be a rotating basis. So we'll probably do, every month we'll hit about 1/12 of what's in SAMS and ask them for any updates. Public and providers send emails at any time with changes. So if you're on the site and you see that we've misspelled your agency name or a service that you provided is no longer being provided, or you've got a new 2-year grant that's vital to you, you can send us an email and we can make those changes in real time right on the website. One of the really good things about this new website, it does have multiple ways to get resources. So people can click on contact local agencies, and they'll get the link there to our major partners in the whole ADRC effort, including, of course, the area agencies on aging. They can also search by program or organization name. So if you know you want to contact the Cape May County Board of Social Services, you don't have to do a search anywhere else on the site. You can go to this one link and get there. You can also search by identified need, and even here they have choices. They can either type in into a search box a term, or there's a list that we can modify over time that has some subject matters, and they can click on there and get what they're looking for. We also have a section called I Need Help With, and this has a checkoff list of identified needs. So they can check off, yes, Mom needs help with this, this, and this, and then search by those topics. And that searches two of our major categories. That searches both the Learn About section that has all the federal information, and that also searches the services providers database that we maintain of New Jersey providers. Also, by going to the Learn About section, you can type in a topic, or you can open up a major category folder and browse. Some folks just like they're interested in caregivers. There's a major folder there for caregivers, and then you can just look at what's available and search for things that way. Other features on the site, it allows us to do a lot of keywording and aliasing. So when people type in something that we didn't think they typed in, we can, as long as we anticipate it, we can put that in and help them get what they're looking for. So, for instance, our term of art is congregate meals. If you were to go to a senior center and get a lunch meal, we call that congregate meals, but not too many seniors know that term. So we've keyworded that with food, meals, lunch program, midday meals, all these other words, so that if a senior uses that, they'll still get the information that we have on the site. The site has a Google Maps and a site translations feature I'll show you in a few minutes. It also has a user account, which is really a neat thing. This allows you to open up an account on the site just like you would open up an account at Macy's website. So as you're shopping website and you find a tie you like and you find a suit you like, you sort of send it all to the shopping cart, and then you can check out at the end. You can open up an account on this site and save the links that you found and the information that you found, and then you can share that with others. So, for instance, I have a brother in California, and if we were looking for services for my mom, I may find something, save it on the account that's our family's account, and then send him an email and say, look, when you get home tonight, check out this thing. I think this might help Mom. The site also has the ability to add Word, PDF, HTML documents all to our Learn About section, so it's very flexible on the types of files we can load there. And again, it gives us the ability to change and update the site instantly. Now, how would this help you as service providers? Well, one thing is, not so much hospitals and nursing homes, but other offices close at 5 or 4:30. So this really extends our ability to provide information and referral services or information and assistance services around the clock. So folks who are working the midnight shift or work all day and then they get home at 7 o'clock and all their offices are closed, they can go on this site, find resources, and then when they call during their break the next day, they'll have a more focused idea of what it is they're looking for. The Learn About section, again, that's just a new tool. We've never had that before. Services and providers, again, that's in SAMS, but not all of our partners have access to SAMS, so this gives them access to all the not the client information, but the provider information that we have on that system. Again, you can create an account, and there's more to come, including we'll have at some point we'll have a printable directory there. So if you wanted to do a directory for your county just on transportation services, anything that's on this website you'll be able to produce onto a printable directory. And I'm going to go to the site, and it'll be a very quick tour of it. Okay, this is the home page, and again we have links and lots of different ways to find information. You can search coming down this left navigation bar. So there's just about us. That's really not all that important unless somebody wants to figure out why they're here. But I need help with service providers, contact, Learn About, that's all down here. It's also embedded in here, so it explains a little bit more what they can expect if they go to the left. The service providers include services, facilities, products, and providers that can assist you with your needs. We can change the font size, so if that's a little hard to read, you can click there and go higher up. At the bottom of the page, we do have a toll-free phone number, so if someone's not very good on the website, but they found this site, we're given a number right away they can call and get information. And that number does, if you call that from a landline, it will bring in your county's area agency on aging or ADRC site. So you'll get to the main players in your county if you call that number. You can add this website to your favorites by going up here. You can tell a friend and send an email to somebody and say, I found this site and I think you should take a look at it. And of course you can print the page. And this follows us as we go through the site. I want to show you the Google Translation service. This is something that has been greatly improved over the years, and it has maybe 140 plus languages here, and it translates the entire site until you change it back to English. So I'll just pick Lithuanian, and you'll see the page change over to Lithuanian. And if we go to the next page, it'll take a second, go to its English, and then again translate it into Lithuanian. So since I don't speak that, I'm going to change it back to English, so I don't get lost on my own website. We'll go back home. There's also the quick search up here for services providers or to learn about. You type in what you're looking for and hit go, and that'll take you where you want to go. Log into my account. This I'm going to turn on now, so I can show you later as we get into the site. This is how you would create an account. In my case, I'm already in here. As soon as that finishes loading, I can show you what's on my account. So this is me. I can change my password, etc. The newsletters, we haven't added anything in here yet, but we do have a favorite. So as I go through the site and start clicking on things, it'll pop back into this favorite section.
Hi, everybody. This is Dinah Bones. I just heard that we can't see the website, so let us briefly take a look what we can do, and we'll just get it right back up. You. Hi, this is Dinah, the moderator. Is Ashley on the line with the WebEx rep? Ashley, are you on the line from WebEx?
Yes, I'm here.
Hi, Ashley. We just found out that participants cannot see the website. Could you please guide us through?
Sure. They cannot see the QualityNet, the actual WebEx?
They can see the sharing of the website.
Oh, okay. If you go to the upper right-hand corner, upper left-hand corner, select Share, and then My Desktop. And then you can pull up the internet site that you are referring to.
Okay. Okay. Can you confirm that you can see the ADRC website, Ashley? Are you logged in?
Yes, I can see that.
Okay, thank you. I do apologize.
You're welcome.
Okay, I'm sorry, there's two folks. I won't go over everything I did, but now you can see the site just very quickly again. There's all these different ways to find the information I've spoken about already down the left-hand side. Through here, this search box up in this corner. I did want to just show you these features since you missed that. This right is the font size for folks with visual difficulties, and this changes the language on the site to whatever language you may speak, and that will follow you throughout the entire site. So those are a couple pretty good features right off the top that, again, we didn't have on any other website, so I'm happy it's here. There is a toll-free number right on the home page. That's the one, again, that goes to your county office on aging. And I believe I'm still logged in, so let me just show you the account. That's the button you would hit to create an account. I've already created it. I'm already logged in. And when I click on favorites here, you'll see a list of some of the agencies that I've already been through the site and decided to save favorites, and here they are. So again, if I wanted to share this with my brother, he could come on here tonight, log in as me, and find the same information. I just wanted to go show you Learn About real quick. As I said, if you prefer looking through major folders, you can just open one of these folders. Here's caregiver support. And then you can sort of hunt and peck and find the things that you're interested in. You may prefer to just come up here and type something in. So let's say that I wanted information on food stamps. And that program has changed its name, but we have that as one of the aliases now and press search. And this is going to search that national database that we've added some things to. So if I click on food stamps right here, it's going to take us to the New Jersey food stamp page. Now this is one that if you're on the site, pages have the site for Hawaii. If you're on Hawaii, you're not going to find this. It's one of the resources that we've added. New Jersey Helps was one of ours. This Academy of Nutrition, dietetics. That's dietetics. Okay, yeah. I got my reading glasses, so I'm looking at the far whiteboard. This is a federal website, probably. This is not the. Yeah. So this is USDA. So again, we have national resources in here, and we were able to add state resources to it as well. Services and providers. Again, at this point, there's only about 400 service providers on here. Those are the ones who have contracts with our county offices on aging. We have a list here that you can search by, where you can type in what you're looking for up top, and then look for what area, what zip code, how far you're willing to travel from that location to get what you're looking for. So I'm going to type in, let me just type in meals, and search, and we're going to get 81. Well, that's a lot to go through, so let me go back. I'm still looking for meals, but I'm going to type in a zip code from South Jersey, 08234, and say I'm only willing to go 10 miles from that location. So let's search again, and now we've gotten it down to 3. And these 3, the first default on every search that we have is to the county office on aging or the area agency on aging for the ADRC. So we were afraid somebody might come on the site, type in some word or term we've never thought of before, and we didn't want to get a blank page. So if they have one of those questions we didn't think of, they at least have a phone number and a contact to get more information. Here's the Atlantic County Division of Intergenerational Services. So this is sort of the generic one. This is the one specifically for Atlantic County. And here's one of the meal sites. So I'm going to click on that, United Methodist Church of Absecon. Here's the option for me to add it to my account, so I'll click on that now, and then I'll show you that in a minute. Here's a map feature, so I can find out exactly where this place is, so I can determine, there's a bus stop on the side there, or, that's not too far, I can drive there, I can avoid the major road that I don't like to drive in, so that's really a kind of neat thing. And it gives a short description of what it is that they do, and here's what they do, prepare lunches, so that's why they came up when I clicked in meals. Congregate Meals is one of the things that they offer. Again, request provider information, confirm provider information. This would send us an email telling us what's happened, or if there's a change that's needed. So you saw I clicked on add this to my account. It's offering to take it off. So if I call there and then ends up that's not the right place, I can take it off my account. But in the meantime, I'll go back to my account. Slight delay. And you see if I click on favorites, it's right there. So it's really a good way to, as a service provider too, if you found something on the site you really like, put it in your favorites, and the next time somebody calls you for that, you won't have to go search all over the place. Let me just go back to service providers. It has one other option down below. You just search by alphabet. So if you know the name of your agency and you want to find it easily, they were United Methodist, so I'll go U. United Methodist Church of Upseek, and there they are. I didn't have to do all those other kinds of searches. I've already shown you the provider tab, area served. So let me just show you I need help with. This will be the last thing, and then we can get the questions. This search is from both things. It searches from the national and it searches from our state. So if we were to go here to type in a few things that we want information on, let me see what I do with meals. Eating. So let me put eating, and let's say that we're also looking for some companionship. And now we'll start the search. And now this is the one that's the learn about, and this is the one that's going to give you the local information. So let's click here first, and it's giving us the two categories. So assistance was sort of the meals piece, and the social activities was to find something to do. So let me hit on assistance first. And we're getting some of the same things. Now again, we didn't limit this to an area. So I'm sure we'll find, if we scroll down enough, we're going to find the same meals program for Atlantic that we're seeing up here for Passaic and for Hunterdon County. And if we go to information, this is the Learn About section. And again, here's some of the same websites that we clicked on before. That's the New Jersey's food stamps. This is Congregant Meals. This is a PDF that we have of our, I may have done a mistake there. It may take a while to load down. No, not too bad. This is our federal programs for older persons, book that we have on our website. And if you click on, let's see, nutrition, programs providing meal services, and that has some information on these services. And it's more about what are these services. So I found home delivered meals. I'm not sure how it works. That's what the Learn About library is really all about, is to find out more about the program. So once you find out about the program and you want to get them, that's when you would go into the service providers and find the right person. Let me go back home. Log out. And I hope you enjoy the site, and I hope you use it. And if you have any questions down the road, always send us an email. We have to contact us right here. I answer all those emails for now, so we'll get back to you. Thanks.
Well, thank you so much for sharing your community network, resources, and website. Thank you to Dennis, Barbara, Carol, and Michelle. I do apologize for the technical glitches, but that is the joy, I suppose, of living in the internet age. Now I'd just like to take your attention to our next steps. The goal of this webinar is to enhance connections between all providers in your community. Going forward, you can discuss how to create an ongoing dialogue, whether it's face-to-face or possibly conference calls. Another opportunity would be for the community providers to follow up with hospital or nursing home staff, sharing specific information related to discharged patients after a service plan has been put in place. This would strengthen the link in transferring patients and help to drive down readmissions within 30 days of discharge. I would also like to share some upcoming opportunities. A webinar on November 7th. This will be conducted by committee members that created the Universal Transfer Form. And our next coalition meeting on Wednesday, November 14th, and that will be hosted by Atlantic Care. At this time, I would like to open up the floor for questions, and I ask Stacy, our operator, to help facilitate that.
Yes, ma'am. Ladies and gentlemen, at this time, if you have any questions, please press the number 1 key on your phone. Again, if there are any questions at this time, please press the number 1 key on your phone. Our first question comes from Lauren Mulrooney with the Holy Redeemer. Please go ahead.
I was just wondering if we can get copies of the slides.
We can get those out, sure.
Okay, thank you.
Again, ladies and gentlemen, if there are any more questions, please press the number 1 key on your phone.
This is Dinah. As we wait for questions to come in, I just wanted to clarify that 1-800 number, the 877-222-3737, that actually links to any local ADR site?
Yeah, the way that phone system works, if you call from a landline phone, so you call from your home, it reads where you're calling from and sends that to your county office on aging. Unfortunately, a number was created a while ago before they invented the cell phone. So when you call on cell phone, you may get another county. Just tell them where you're calling from, and they'll point you in the right direction.
Thanks for clarifying.
There are no more questions. Thank you.
Well, thank you for attending today's webinar. And now, please wait while the operator conducts the polling. Also, after completing the polling, you will be able to download and print your education certificate from attending today's program, and you will find that tab on the top of your web page there. Thank you.
Ladies and gentlemen, we will now begin our polling session. Please respond to the following. My knowledge increased based on this presentation. Press 1 for yes and 2 for no. Again, my knowledge increased based on this presentation. Press 1 for yes and 2 for no. And just one moment while we wait for the response. Polling is now closed for this question. For our next question, again, please respond by pressing 1 for yes and 2 for no. I plan to share key points of this presentation with others at my organization. Press 1 for yes and 2 for no. Polling is now closed for this question. For our next question, again, press 1 for yes and 2 for no. I am able to use this information in my work. Again, press 1 for yes and 2 for no. I am able to use this information in my work. Please hold for responses. Polling is now closed for this question. And for our last polling question, again, press 1 for yes and 2 for no. Overall, I was satisfied with this session. Press 1 for yes and 2 for no. And our polling session is now closed.
Thank you very much. And again, I do invite everybody to download and print out that certificate. Thank you, and have a wonderful day.
Thank you, ladies and gentlemen. This concludes your call. You may all disconnect.